Alright, so today we're going to be administering medication via piggyback. So this means that the primary line will already be running in the patient's room. More than likely it's going to be normal saline. So I'm going to go ahead and grab my doctor's orders and the MAR again. So the physician orders read Flagyl IV, and they say 500 milligrams every 6 hours. So the action for the Flagyl is used to kill anaerobic bacteria, and the purpose is antibactericidal. Recommended dosage is also 500 milligrams every 6 hours, and the side effects for this drug is severe infection, dizziness, headache, and meningitis. Some of the contradictions include hypersensitivity during the first trimester of pregnancy, hepatic impairment, and some of the nursing implications include obtain specimens before therapy, monitor the intake and output, and assess the IV site for phlebitis. So now that this checks out, we're going to go ahead and grab our medication, which is right here. This is Flagyl, and it is 500 milligrams per 1 milliliter, and the doctor orders 500 milligrams. So we're going to go ahead and do the calculations right here. Go ahead and do 500 milligrams. X equals 500 milligrams over a milliliter. So the patient is to receive 1 milliliter of Flagyl into the mini bag. So what we're going to do is we're going to wash our hands. Go ahead and do that. Hand hygiene. So we're going to, this is a Flagyl right here. This is a needle that should technically be sterile. We have one here in the wrapper, but this one doesn't have one, so we're going to assume this is still sterile. We're going to go ahead and cleanse the top of the Flagyl vial with an alcohol swab and dispose of this. We're going to go ahead and pull up the 1 milliliter of air into this syringe right here. Uncap this, throw that away. We're going to go ahead and stick this, inject the 1 milliliter of air into the vial, flip it over, and pull 1 milliliter of the medication up. I'm going to ensure that it is accurate to 1 milliliter. I'm going to take that out. I'm going to go ahead and do the scoops method and throw this in the sharps for this purpose, but normally you would never recap a needle. So I'm going to put this into the sharps, and this is a brand new needle. I'm going to go ahead and banana peel this and connect the needleless device. So this is sterile because there's a cap on there. And then this is the mini bag that we're going to administer the medication through via piggyback. So once again, we're going to clean the site right here with alcohol. We're going to go ahead and inject the medication in there. That's good. We're going to dispose of our needle into the sharps. Then after that, we're going to label the medication that we added to it, which is right here. We're going to write the dosage. We're going to write the dose, the drug, the amount, the date, the time, and the patient, along with my initials. So now this is good to go. This is ready. Now this is the tubing that I'm going to use for the piggyback. I'm going to go ahead and do the calculations for this also. So the piggyback is set to run at 1 hour, and the drip factor is 10 drops per milliliter. So we're going to go ahead and do 100 milliliter mini bag divided by 60 minutes, which is 1 hour, times the drop factor, which is 10, and it comes out to about 17 drops per minute. So we're going to do this. We're going to open this up. We're going to take this out. So, oops. This is good to go. We're going to make sure this is clamped so that the antibiotic doesn't run out. That's good. So these are both sterile tips because they both have good ends on them. So this is a good. I'm going to go ahead and spike our bag, and it's already clamped. So I'm going to take this off, being careful not to touch that. I'm going to take the tip off of that, make sure they don't touch. I'm going to go ahead and spike the bag, just like that. I'm going to turn it over and go ahead and prime my tubing about until it reaches the line, which is good right there. And I'm going to let it run out a little bit so all the air bubbles are gone. And it is to prime the tubing, and it looks good. I'm going to close that clamp up one more time. I'm going to go ahead and label the tubing also with the date, time, and my initials, just so we can know when the tubing needs to be changed. So that's good to go. And then I'm going to go ahead and gather all my supplies again. I'm going to gather my piggyback, my gloves, to hang this. I'm going to go ahead and take my alcohol swabs and my doctor's order, and I'm on to the room. So, let me go ahead and get up. I'm going to go ahead and knock on the patient's room.
Hey.
Hi, how are you doing today? My name is Eric, and I'm going to be your nurse today. Could you just please state your name and date of birth for me, please?
Erik.
Okay, awesome, awesome. Do you have any allergies I need to know about?
No allergies.
Okay, so before I do anything, I'm going to recheck the doctor's orders in the MAR, and I'm going to verify that is the right patient. And we're gonna be hanging a mini bag today via the IV. You already have normal saline running, so we're gonna go ahead and just connect it to that. I'm gonna go ahead and inspect your site, your IV site, right there. I'm gonna go ahead and perform my hand hygiene first before I actually touch him. I'm just pushing the tape down. I'm gonna wash my hands, apply my gloves. So, this is his IV. I'm gonna check the dates on the lines, and they look good. The medication is still dripping and running. The clamps are open. That looks good. I'm gonna assess for patency, and it's still running. Everything looks good. No phlebitis, no edema, no pain or tenderness in the area. It's not warm or anything. So this is unclamped. These are unclamped. It's running right now. So in order to run the piggyback, I'm gonna go ahead and connect this tubing right here to here. And then I'm going to drop the primary. Actually, I did it backwards. So I'm going to clamp the site to close it. I'm going to go ahead and move this back, hang the piggyback higher. I'm going to go ahead and put that there and hang the primary line lower, just like that. And this is not connected yet. So that's that. Now I'm going to take a alcohol swab and cleanse I'm going to go ahead and use this port right here. So I'm going to go ahead and cleanse the site. And I'm going to set the drop factor for the piggyback at 17 drops per minute. I'm going to cleanse that. And then I'm going to connect my piggyback. It's still clamped. I'm going to go ahead and connect my piggyback to this line. That's good. I'm going to unclamp my piggyback to make sure that it's running, which it's not running yet, but it will. So I'm going to go ahead and unclamp this. I'm going to go ahead and unclamp all of the clamps on the primary also. Here it is. So I'm going to unclamp that. So then I'm going to observe to make sure that's running, which it is. It looks good. I'm going to go ahead and inspect the site, which it looks good. It's running through. There's no signs of edema or any infiltration or anything, no phlebitis. The vein still looks good. So now the piggyback is running through the primary saline line, and I'm going to go ahead and let that run now. I can go ahead and dispose of all my unused supplies, and then I'm going to go ahead and take my gloves off and rewash my hands, and then that's the end of that part. So now I'm going to assume that time has passed and the medication has stopped running, so I'm going to go back into the patient's room. Then I'm going to check the piggyback, which it is done running. So I'm going to go ahead and clamp that off. Looks good. I'm going to clamp that, take it off. I'm going to go ahead and grab alcohol again. I'm going to unhook this. So the piggyback is done running. Then I'm going to go ahead and clean the port again. And then after that, I'm going to go ahead and just make sure that the site is still good and still patent. There's no signs of edema around there, no pain or redness. Now I'm going to go ahead and document my findings. I'm just going to go ahead and document the dose, the route, the type of medication, the intake and output, and the amount of time, the date, the route, the medication, and the amount administered. And then I'm going to document the condition of the site, which it looks good, it's still patent. The normal saline seems to still be running fine. And what else? All the clamps are open, and I think that'd be it.